Gold standard. It depends how long the umbilical cord, but usually it's about 7, 8. Put 2 clamps on, between them you cut umbilical cord, right? Okay, what is next step? Physiological labors. Of course, you understand, if preterm labors, retardation of the fetus, baby immediately taken neonatologist, right, nurses, and this baby can be transported even in the neonatology department, right? We're talking about physiology. Who can tell me what's next step?
Placenta.
No, we are not talking about placenta, about babies. What? So how we call it? Skin to skin contact. Some teachers like ask this question. Why it's so important? What do you mean flora? Vaginal flora, which flora? So exchange flora, right, between mother and this baby, right? Why? Because very important what? For immune system, right? Okay, next question. What should be immediately done when baby is born and you cut umbilical cord? Cover baby. Why is so important? Because inside uterine cavity temperature is high. So that's why labor department doesn't matter. Winter, summer, problem with electricity supply, steady temperature, around 23-25 degrees, right? Because sometimes in Ukraine can be a problem with electricity supply. So it means put socks on, head, blanket, etc., right? So this baby can be on the belly, right? And cover it. Also, very important point, what? Psychological factor, right? So finally this mother can see this baby. You know, for some patients very important, especially if before they lost pregnancy or pregnant patient with what? Infertility, you understand what I mean, right? Okay, so it's very important point, because in Ukraine sometimes it's stupid situations. This father, give me this baby, I want to see this baby. No, you will have enough time, just work my money, right? So, but some husbands like egoism, you know, they want first to get this baby. Did you understand? So, did you understand this point? So, wait when stop pulsation, cut, exchange microflora, and baby should be covered, right? Did you understand? Yeah. Very important. Of course, it's physiological way. Any pathology, you should know. Some teachers like to ask about what Apgar score. You know what is it? Neonatology programs. Can ask what is it? You know, remember first, fifth, and 10 minutes in neonatology program, right? It can be random question, right? Okay, so it's not problems this practical part for some students, but some students they can give correct answer. Next, manipulations that you should know. Okay. Should change like this. Okay, so baby is delivered finally. Physiological way, not pathology. How long you should wait for delivery of the placenta?
30 minutes.
Standard, I don't know why, but for example, US books, they give clear number, 15 minutes, right? In Ukraine, 10-15 minutes, because we have a lot of problems with bleeding, right? So it means what? If there is no signs bleeding, you understand what I mean? If consistency of uterus is okay, you can wait, right? But if any problems, for example, you see signs increasing discharges, bleeding, right? You palpate uterus, you don't like consistency. Of course, you can watch, oh, I have 10 minutes yet, right? You should do some manipulation, what?
Manual separation.
No, not immediately manual separation. You should do some external maneuvers, right? For separations of placenta. How you can do? You can make your fingers like fist, pressed on the fundus of uterus. And midwife gently pull umbilical cord. This means help you, right? Okay, you did this manipulation, no effect, right? And you see bleeding is increasing, right? You're doing some another maneuvers, etc., no effect. So it means there are clear indication what? For manual separation of the placenta. So it means what? You should go inside uterine cavity, right? It can be standard question to you. What's the problems with placenta? How we call it? Pathological attachment placenta. If you know classification, I am happy. Acreta and creta, percreta. I never seen in my life percreta. But acreta is very common in Ukraine. Why? Because it's common in patient. What? After abortion, in Ukraine, very big problem. Also high risk patient after CS, by the way. It's like far complication after CS. obstetrician doesn't like to talk about it. You understand what I mean? So rate is steady rising. You know, around the world rate says steady rising, right? Some countries, I know, for example, Poland, about Italy, about 50%. Can you imagine every second woman? In Ukraine, for last 3 years, rate is about 23%. It was about 15. It's completely abnormal. Maybe open door because you get distressed before exam. Okay, so problems with attachment placenta. If you know what causes, I'm happy for you, right? Okay, how are you gonna do this? Let's question this problem. How are you gonna insert your hand inside uterine cavity? So you see, right hand. How? What position your finger should be? Who knows? Yes, correct. How you call it? I tell you. No, you show correct, but obstetrician hand. You know why? How do you think why it's the best position of fingers?
Normal
The smallest circumference. So left hand, you hold umbilical cord. A right hand, of course, should be appropriate anesthesia. You understand? Anesthesiologist should be present, clear why, right? And you go along umbilical cord. Also, very good contact with umbilical cord. You go in vagina, then through the cervix, and finally you reach place insertion umbilical cord in placenta, right? Then you try to reach edge of placenta. And then you do it like some movement, like this, right? And left hand gently pull umbilical cord, right? Gently, gently. And you can feel, you finish this because placenta is already detached, right? You try to catch this placenta, right? And gently move placenta where? To the cervix, right? Some cases can be problems, so that's why not hurry up, do it slowly, right? So finally you push out this placenta out. Did you understand? Right? But your hand should be out or inside uterine cavity? Inside. Why is it so important?
To check for the remaining part.
Yes, you should do examination, uterine cavity. It can be some clots, etc. You try just move this to direction cervix, right? And next point is what? You're doing very important point. Why you do this? Because bleeding. So it's classical obstetrics. How we call it? Massage of uterus. You change position your fingers inside uterine cavity. You do it like fist, and through the anterior wall, right? Abdominal wall. You make movement like this. So it's improved contraction of the uterus. It's very effective manipulation. It's classical obstetrics. Did you understand? It's very high rate. It's effective. If not effective, of course, it should be intravenosus, some drugs, etc., etc. And some severe cases can be what? Not effective, patient losing blood, etc. Leuite prop is aggravating, so the indication what? To operation. It can be even what? Amputation of uterus. Clear? Did you understand? So again, like review. Position of fingers. Did you understand? It's so-called obstetrician hand, smallest circumference. Because some students think it's like vaginal examination. No, it's not vaginal, but it means minus point. Believe me, on state exam, I repeat, it's not classes. Because some of my students think it's like classes. On state exam, I don't have time, I'm tired also. I just make marks, plus, minus, right? Because then some students, you remember I was good students. Okay, you was. But during state exam, you had problems, concentration, it was wrong answer, right? So, inside abdominal uterine cavity, reach edge of placenta, some movement, separate, right? And some students forget, just move your hand out, right? Very important point. Next stage, massage of the uterus. Did you understand, right? What causes this? Pathological attachment placenta. Right? Akreta and crepitarcheta. Akreta is very common in Ukraine because it's like complication after abortion. Did you understand?
Yeah.
Right? So, fetus. Yeah, that's all. Okay, what else? There are some standard questions to you. Remember, during classes I like to ask you, Nigel formula. You know, enough time just asking students simple question. 1st of September, last menstruation, calculate time of delivery. Oh, sir, I need smartphone, etc. What are you talking about? You should immediately calculate in your brain, right? Because patient will be confused, right? So 1st September minus 3 months plus 7 days is going to be 8th of June, right? So is it problematic question? No, right? So that's why it can be some like basic question to you, right? So it's like, How we divide whole pregnancy period? Embryogenesis, fetogenesis. For example, I like to ask, 7 weeks of pregnancy, do we use term fetus or embryo?
7 weeks.
Yes.
Embryo.
Yes, of course, embryo. We use term of fetus usually after 10 weeks. Miscarriage. A lot of question about miscarriage. What term of pregnancy is the highest risk miscarriage? First 12 weeks, about 50%. Smaller term pregnancy, higher risk with genetic factors, right? It's not problematic patient. Again, my students which had classes with me, it will be, I'm asking like standard questions, the same as during class. If you don't know, inside me I'll be angry, because it's for sure it was the same question. But of course it depends what cases you get. Did you understand?
Yeah.
You don't know? Sorry, cousin. No deal. It's state exam. Also it will be other teachers, right? So it's like witnesses, you don't know. But usually this part not problem. Just if you've been on consultation, just listen carefully, don't hurry up, because some students want to finish immediately. You know, the thing is like 1 hour they get diploma. No, not hurry up. Just thinking, that's all. You know, this question I'm a liberal. I understand. You know, I don't like the system that 1 day to exam. Some students tired, etc. Right? But listen, if you don't know basic questions, sorry. You know, okay, because there are some cases problematic. You know, it's like some like exceptions, some pathology. I understand it's problem. You know, it's excuse, right? But these basic topics, I told you what topics you should know. Okay?
Yeah.
Good? We'll see. We'll see. So, 8 a.m. you should